Bismillahirrahmanirrahim. My name is Dr. Ida Shahram Sarvan, under my supervisor, Professor Dr. Saira Afzal. My topic for today is planning techniques of health services. Quote of the day is: "We are what we repeatedly do. Excellence, therefore, is not an act but a habit." Learning outline: concept of health planning, monitoring, and evaluation. What is health planning? Purpose of health planning. What are health needs and demands? What are objectives, targets, and goals? Steps in planning cycle. What is monitoring? What is evaluation and the national health policy? Learning outcome. At the end of the presentation, participants will have a broad overview of health planning and its purpose. They will have a grasp over the pre planning aspects along with the cycle of planning. They will also learn about evaluation and its basic steps. And lastly, how health needs and demands are met. Planning and management are considered essential if higher standards of health and healthcare are to be achieved. The purpose of planning is to meet health needs and demands of the people. Health needs are defined as deficiencies in health that call for preventative, curative control, or eradication measures. In the need for medical care, safe water supply, adequate nutrition, immunization, family planning are all considered community health needs. Why plan? Planning is basically for tomorrow and management is for today. The purpose of planning: to match minimal resources with the problems, eliminate wasteful expenditures, develop the best course of action, and improve services to include health, financial services, etc. Planning in the broadest sense involves three steps, which include plan formation, ex- execution, and evaluation. Health planning, a process of deciding how the future should be better than the present for proper utilization of health system resources and for improvement of health services. National health planning has been defined as the orderly process of defining community health problems, identifying unmet needs, and serving the resources to meet them, establishing priority goals that are realistic, feasible, and projecting administrative action to accomplish the purpose of the proposed program. Planning results in the formulation of a plan. A plan is a blueprint for taking action and it consists of five major elements: objectives, policies, programs, schedules, and budgeting. Pre-planning. It is the preparation of planning with preconditions of government interest, strong political will, administrative capacity for proper coordination of activities and implementation of plans, legislation, policies translated to legislation, and organization for planning, example, planning commission. This is the planning cycle and it involves 8 steps. The first step includes analysis of the health situation, establishing objectives and goals, assessment of resources, fixing priorities, writing of a formulated plan, programming and implementation, monitoring, tracking the track, and evaluation. This is how it's expressed in cyclical form. First, analysis of the health situation. This involves collection, assessment, interpretation of information in such a way as to provide clear picture of the health situation, the population, its age and sex structure, statistics of morbidity and mortality, epidemiology and geographic distribution of different diseases, medical care facilities such as hospital, health centers, both public and private, technical manpower, various categories, and the analysis of these problems brings out the health problems, the health needs, and the health demands of the population. Establishment of goals and objectives. Objectives and goals are needed to guide efforts. Unless objectives are established, there is likely to be haphazard activity like uneconomical use of funds and poor performance. Assessment of resources. Resources are assessed and a balance is structured between what is required and what is available. Fixing priorities. Once the resources are determined, then establish priorities in order of importance or magnitude. In fixing priorities, attention is paid to financial constraints, mortality and morbidity data, disease which can be prevented at a low cost. Once priorities are established, alternate plans for achieving them are also formulated and assessed. Write up of a formulated plan. The plan must be complete in all respects for the executive of a project. For each proposed health program, the resources required are related to the results expected. It would be left to the Central Planning Authority and the government to consider modifications of a plan relating to allocation of resources. Programming and implementation. Once the health plan has been selected and approved by the policy making authorities, programming and implementation are begun. Main considerations at the implementation stage include Definition of roles and tasks, selection, training, motivation, and supervision of the manpower involved, organization and communication, efficiency of health of individual institutions such as hospitals or health centers. Monitoring. Monitoring is the day-to-day follow-up of activities during their implementation to ensure that they are proceeding as planned and are on schedule. Evaluation is mainly concerned with the final outcome with factors associated with it, measures the degree to which objectives and targets are fulfilled and the quality of results obtained. Definition of health planning by WHO, the orderly process of defining community health problems, identifying unmet needs, surveying the resources to meet them, establishing priority goals that are realistic, feasible, and projecting administrative action to accomplish the purpose of the proposed program. This health planning basically involves emotional dimensions, which includes fluctuations in demand and the fact that health service providers are often dealing with life and death situations, complex relationships, which basically includes that the healthcare industry is also made up of many separate entities operating in a virtually uncoordinated manner and often at cross purposes and categorized by a variety of different customers, financial characteristics different from other industries whereby the end user may not make the consumption decision or pay for the service provided, and diversity of functions that is different and entities perform different functions in single entities. Resources involve manpower, money, materials, skills, knowledge, techniques, and time needed or available for the performance or support of action directed towards specified objectives. Planning is basically the end result and involves an objective. This is a precise point to be achieved following the implementation of a development proposal plan. It may or may not be achieved and it's the end point of all activities. Target is the discrete activity that is to be fulfilled in order to achieve the objective. It indicates the degree of achievement of the objectives. Objectives are considered with the problems directly, while the target is concerned with the factors influencing the problem. Goal is ultimate desired state towards which objectives and resources are directed. It may be described in terms of what is to be attained, the extent to which is to be attained, the population or section of environment involved, the geographic area in which the proposed program will operate, and the proposed length of time required. Unlike objectives or targets, it has no time constraints, resource limitation, are necessarily attainable. The goal setting should be specific, measurable, attainable, relevant, time bound. Planning for health involves three types of activities: assessment of the current status, identification of the desired state in the future, specification of interventions and other activities to achieve the new desired state. Fixing priorities. This involves establishing the priorities in order of magnitude of health problems. Prioritization is based on financial constraint, mortality, morbidity, data, disease, which can be prevented at low cost, political and community interests. Once priorities are established, alternative plans are formulated and assessed to be determined whether they are practical, feasible. Alternate plan with greater effectiveness is are chosen, programming and implementation. Once the plan is approved by the policy making authorities and basically that's when implementation is begun. Effective implementation of a program depends upon the existence of effective organization. The main consideration and implementation stage includes definition of the role and task, selection, training, motivation, and supervision of manpower involved, organization and communication, and efficiency of implementing institution. Evaluation is the final step of the cycle. It should be both concurrent and terminal. The purpose of evolution is to assess the achievements of the stated objectives, its adequacy, efficiency, and its acceptance by the people. Evaluation measures the degree to which objectives and targets are fulfilled and the quality of the results obtained. It measures the productivity of the available resources in achieving measured output. Evaluation makes it possible for the reallocation priorities and of resources on the basis of changing health needs. Components of the evaluation process include relevance. Relevance relates to the rationale for adopting health policy in terms of their response to social and economic policy and to having programs, activities, or services in terms of their responses to essential human needs. Adequacy. Adequacy implies that sufficient attention has been paid to certain previously determined course of action, such as the various issues to be considered during broad programming. Progress is concerned with the comparison of actual with the comparison of actual with scheduled activities, the identification of reason for achievement or shortcomings and indications for remedies of any shortcomings. Efficiency is another factor which is an expression of relationship between the results obtained from a health program or activity and the efforts expended in terms of human, financial, and other resources. health processes, and technology and time. Effectiveness is an expression of the desired effect of a program, services, institution, or support activity in reducing a health problem or improving an unsatisfactory health situation. Impact is an expression of overall effect of a program, service, or institution on health and related socioeconomic development. Analysis of results. Analysis of the data and interpretation of data and feedback to all individuals concerned should be should take place, which will provide opportunity for discussing the evaluation results. These involve taking action based on the evaluation results. Actions are taken to strengthen or modify the program, which may call for shifting of priorities, revising the objective, etc. Reevaluation. Evaluation is an ongoing process which is needed to make the health programs more relevant, efficient, and effective. The national health policy. A policy must be thought of a system which provides the logical frameworks and rationale of decision making for achievement of intended objectives. Health policy. Policy relating to health aim to satisfy basic human needs and therefore influence other social, economic, human, and developmental goals. National health policy is an expression for goals for improving the health situation, priorities amongst those goals, and the main directions for attaining them. The National Health Policy of 2002 is the objective for this is the main objective of this policy is to achieve an acceptable standard of good health amongst the general population of the country. Recent advances. Health planning as a regulatory strategy, a discussion of its history and current uses. This is from PubMed. Abstract. Federally mandated health planning is one of the most significant responses to the cost crisis of American medicine. Trade is an objective and rational mechanism of determining the future. Planning is a socially acceptable means of exerting third party control over a sector of the economy long able to escape meaningful controls on its growth and development. However, far from being the neutral science which it is heralded to be, the planning process serves the interests that are able to control its use. Secondly, advancing the state of the art in healthcare strategic planning. Abstract for this is a recent survey of the state of strategic planning among healthcare organizations indicates the planners and executives believe that healthcare strategic planning practices are effective and provide the appropriate focus and direction for their organizations. When compared to strategic planning practices employed outside of the healthcare field, however, most healthcare strategic planning processes have not evolved to the more advanced state of the arts levels of planning being used successfully outside of healthcare. MCQs. Question number 1. Planning in the broadest sense involves 3 steps. A plan formulation, research, analysis. B. Thinking, mind map, and structure. C. Plan formulation, execution, and evaluation. D. Pre-planning, research, mind map, and E. Research, structure, attention to detail.
D.
No, the answer is C. Planning, formulation, execution, and evaluation. This is in the broadest sense. There was a picture in one of the first slides. Question 2. Evaluation is an ongoing process that repeats itself in a cyclic manner, and this is called A. Pre-planning process, B. Planning cycle, C. Purging cycle, D. Systemic cycle, or E. Evaluating body.
B.
Yes, the answer is B. Question 3. An important element of planning is the setting of clear-cut objectives, targets, and goals. What is an objective? A. The making of a judgment about the amount, number, or value of something. B. The supposition or proposed explanation based on the basis of limited evidence as a starting point for further investigation. C. Ultimate desired state to which the resources are directed. D. It is the planned endpoint of all activities. It is stated in terms of the measured amount of progress towards a goal. Or E. Dividing potential audience into segments, choosing one or several to target using especially tailored messaging.
D.
The answer is D, yes. Question 4. The minimum essential requirement of health planning include which of the following? A. Population and mortality and morbidity statistics. B. Medical care facilities. C. Manpower and training facilities. D. Beliefs and attitudes of people towards health and disease. Or E. All of the above.
E.
Yes, the answer is E. Question 5. What is the first step of a planning cycle? A. Fixing priorities. B. Evaluation. C. Analysis of the health situation. D. Monitoring. Or E. Assessment of the resources.
C.
The answer is C. Yes. Question 6. What are the essential resources needed in planning techniques? A. Manpower, money, materials, skills, time needed, and knowledge. B. Effort, attention, books, and teachers. C. Objectives, pre planning skills. D. Raw materials, attention to detail, system and check. E. Support of the government and money solely. Yes.
A.
A is the answer. Question 7. Once the health plan has been selected and approved by the policy-making authorities, programming and implementation begin. A main consideration and implementation stage includes A. Definition of roles and tasks with organization and communication, selection and training of manpower involved. B. Bringing to light the role of superior. C. Seeking aid. D. Checking on existing resources available. Or E. Hiring manual labor. Okay, so the answer is 7A. Question 8. Health service planning includes the following components. A. Emotional dimensions, complex relationships, and financial characteristics. B. Hypothesis planning and execution. C. Employment and firing staff. D. Setting boundaries and guidelines. Or E. All of the above.
B.
No, the answer is A. Question 9. Health needs are defined by A. Deficiencies in health that call for preventative, curative, control, and eradication measures. B. An ultimate desired state towards which the objectives and resources are directed. C. Fluctuations in demand and the fact that healthcare service providers are often dealing with life and death situations. D. It is the planned endpoint of all activities. It is stated in terms of measured amount of progress towards a goal. Or E. The rationale for adopting health policies in terms of the response to social and economic policy.
A.
Yes, the answer is A. Question 10. Planning a new hospital starts with setting goals for the hospital without which organization cannot have a definite direction or focus. Which of the following areas is not considered by an organization while studying existing hospital facilities in an area? Question A. Bed ratio. B. Hospital occupancy. C. Physical condition of facilities. D. Volume of services provided. Or E. Perception of patients.
D.
The answer is E. This is the key. These are my references, and this is the link to the YouTube channel. Thank you. Should I stop recording, or does anybody have any questions? Okay, thank you.